Away from that to the health crisis in the country, and there is no end in sight for the ongoing nurses strike, with both sides of the bargaining teams maintaining their hard stance. While the medics insist they will not call off their 42-day-long strike until their demands are fully met, the Council of Governors say they cannot and will not pay any cent to the striking healthcare workers. The nurses union officials, who are faulting the governors for frustrating their efforts for dialogue, now wants President Uhuru Kenyatta to intervene and end the stalemate. Purity himself with that report.
Hata waende strike miaka mia, hakuna pesa mimi nitalipa, kwa sababu our nurses wanalipa hata kuliko engineer.
The sentiments by the Council of Governors Chair Wycliffe Oparanya seem to have added insult to the already agitated nurses now on strike for more than a month.
The engineers that the governor is referring to are not constructing any roads in our hospital beds.
But Oparanya to say, I will not pay, as if the government budget allocation, the money that comes from taxpayers, are his own personal money. That was wrong. It's unacceptable.
The nurses union officials are faulting governors for declining to assent to the return to work formula and frustrating efforts for any possible dialogue.
It is wrong for the governor to say that we are getting 16 allowances. I'm a senior nurse. I'm getting only 4 allowances, 3 of which are allowances which are common to almost every public servant.
The county government of Machakos is particularly on the spot for allegedly blackmailing their workers to return to work and later issuing sacking letters for participating in the same strike.
I am telling you, your officers, Governor Mutua, that I will protect, and this union will protect, the Machakos County government nurses. They will not despair, and I want to tell them, don't despair. We will protect you. None of you, even one of you, will not be sacked.
The nurses have vowed to continue with the strike until both the two levels of governments, among other things, commit to provide quality personal protective equipment, provide comprehensive cover and group life insurance to all nurses, risk allowance, among others.
There will be no going back without commitment of the two levels of government to compensate families who have lost nurses due to COVID-19 and other elements. We will not go back to work if there's no commitment to refund money that has been spent by nurses during their treatment when they were sick.
42 days of industrial action by nurses across the country. Clinical officers and laboratory officers have also joined in. The Council of Governors says they can't and won't pay. The end game, the medics say only the president can end the stalemate. Purity Museo, Channel 1 News, Nairobi.